Hi, everyone, and welcome to The Balancing Act. I'm Olga Villaverde.
And I'm Monto Williams. Call your friends, because today is going to be a great day. You know, I'm so happy to be here with you today.
And I love you, too.
There you go. Well, today it's all about a health special.
That's right. First, how to slow down geographic atrophy caused by age-related macular degeneration. The information coming up.
Wow. And we have some personalized care when it comes to ED. We're checking in with the folks from HIMSS.
Plus, hormone health and the role it plays in the mouth-body connection.
And it all starts right now when the Balancing Act begins. Come on.
You had your cereal this morning.
I had some. Coffee, too.
Today we're talking about a medical condition that dramatically affects our central vision. And while folks may be familiar with age-related macular degeneration, AMD, they might not be aware of GA.
That's right. GA refers to geographic atrophy, and about 1.5 million people in the U.S. have GA.
Joining us today with more are Dr. Priya Vakharia of Retina Vitreous Associates, based in St. Petersburg, Florida. And also joining us is Richard Kuhn, who has been diagnosed with GA.
Welcome. Thank you both for being here on the show.
Good morning.
Absolutely.
Yeah,
Good morning.
thank you for having us.
Doctor,
Absolutely.
let me start with you. What exactly is GA? I've never heard of it.
So GA is geographic atrophy, or the advanced form of dry age-related macular degeneration. This is a condition that happens as patients get older, and it is progressive, non-curable, and can result in vision loss over time.
And you know, Richard, you and I have a lot more in common than you think. You're in the military, right? 20 years as an Air Force pilot. That's incredible. Good job. And thank you for your service, sir. And also, I mean, you know, it must have been unnerving when, you know, they started telling you something's wrong with your sight, right?
As a pilot, you're dealing with focus, vision, absolutely. You know, in 2015, I started noticing straight fences would be wavy, lines on the road would curve or sometimes disappear. I knew it was time to see an eye doctor. They diagnosed me with age-related macular degeneration at the time, and I was eventually diagnosed with GA. At that point, there wasn't a lot they could do for that particular eye condition.
I also read here that your mother also had vision problems. Is that correct?
Yes, she started losing her eyesight when she was in her 80s. It was determined later on that she had dry AMD. I would see her gradually deteriorate, not being able to take care of herself, you know, personal care items, things like that. That provided a lot of motivation for me to pay attention and start treatment. Well, I'm also a magician. I enjoy entertaining, and I love going to conventions and not just attending, but also performing at them. And that was the real motivation for me to find a treatment to be able to slow the geographic atrophy.
Doctor, let me bring you in. I know you mentioned that GA is not curable. You said it's progressive. What are the risk factors, symptoms? Obviously, Richard saw the fence and it became wavy. For those people maybe out there that are actually experiencing something.
Yeah, so that's a great question. Sometimes patients will have distortions in their vision, but sometimes it's non-specific. It's just difficulty reading or difficulty with your activities. And the biggest risk factor is age, family history like Richard, and then smoking is a big risk factor as well. So I encourage everyone to get eye exams just to screen for these eye conditions every year.
So now let's talk about SYFOVRE and what patients can expect.
So SYFOVRE was FDA approved in 2023. Richard was actually one of the first patients to get treatment with SYFOVRE once it was commercially available. It's an intravitreal injection or an injection given in the eye by a retina specialist, and it can be dosed anywhere from 25 to 60 days. It's the only FDA approved therapy that's allowed for every other month dosing for the treatment of GA. SYFOVRE slows progression of geographic atrophy over time. It doesn't stop or reverse progression. And what patients would expect is to come into the office, get numbing in the eye, and then get the injection. Do not receive SYFOVRE if you have an infection or active swelling in or around your eye that may include pain and redness, or are allergic to pegcetacoplan or any ingredients in SYFOVRE. SYFOVRE can cause serious allergic reactions such as troubled breathing, tongue, face, lips, or mouth swelling, rashes, and hives. Please stay tuned for additional important safety information.
When you went to talk to Dr. Zakharia, what did you discuss?
Well, when When SYFOVRE became available, I was very proactive in discussing with my eye doctor. He recommended the treatment. I was a good candidate and referred me to Dr. Beccaria, who's a retina specialist. Dr. Beccaria and I talked about all the risks and benefits, and I received my first treatment in early 2023. She decided that every 2 months was a good fit for me. Dr. Beccaria, her procedures and techniques are fantastic, especially in numbing the eye before the SYFOVRE treatment.
Richard did all of the right things by coming into the office, getting his injections. And as with all therapies, it's really important to talk to your doctor to see if you're a candidate.
Richard, any additional thoughts?
If you or your loved one have GA, talk to your eye doctor or retina specialist and discuss if SYFOVRE is right for you. Don't wait.
Richard, thank you so much for sharing your story.
Thank you.
Appreciate it, Doctor. Thank you for all the information.
Thank you for being here, for sure.
And if you'd like more information, go to SYFOVRE.com or, like the doctor and Richard said, talk to your doctor, your eye doctor.
And of course, you can always go to our website, thebalancingAct.com. We'll stay tuned right now for some really important safety information.
Indication and important safety information. What is SYFOVRE? SYFOVRE, pegcetacoplan injection, is a prescription eye injection used to treat geographic atrophy, GA, the dry, advanced form of age-related macular degeneration, AMD. Who should not receive SYFOVRE? Do not receive SYFOVRE if you have an infection or active swelling in or around your eye that may include pain and redness, or are allergic to pegcetacoplan or any ingredients in SYFOVRE. SYFOVRE can cause serious allergic reactions, such as trouble breathing, tongue, face, lips, or mouth swelling, rashes, and hives. SYFOVRE can cause serious side effects, eye infection, endophthalmitis, or separation of layers of the retina, retinal detachment. Call your healthcare provider right away if you have eye redness, light sensitivity, eye pain, or any change in vision including blurred, wavy distorted vision, small specks floating in your vision, or flashing lights. Severe inflammation of vessels in the retina, which may result in severe vision loss. Call your healthcare provider right away if you have eye redness, light sensitivity, eye pain, or any change in vision including blurred, wavy distorted vision, or flashing lights. Risk of developing wet AMD. You should be monitored for signs of wet AMD, and you should report if you have any change in vision including blurred, wavy distorted vision, black spots, or loss of central vision to your healthcare provider. Episodes of eye inflammation. You should report any symptoms including eye redness, light sensitivity, eye pain, small specks floating in your vision, or any changes in vision to your healthcare provider. Increase in eye pressure within minutes of the injection. Your healthcare provider will monitor this after each injection. Before receiving SYFOVRE, tell your healthcare provider if any of the following applies to you. If you have a history of seeing flashes of light or small specks floating in your vision, and notice a sudden increase of size and number of these specks. If you have high pressure in the eye or glaucoma. Tell your healthcare provider about all of your medical conditions, including if you are or think you are pregnant, breastfeeding, or are planning to have a baby. Ask your doctor for advice before taking this medicine. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What should I avoid while receiving SYFOVRE? After an injection or eye exam, your eyesight may temporarily be impaired. Do not drive or use machinery until your vision recovers. What are the most common side effects of SYFOVRE? Eye discomfort, wet age-related macular degeneration, small specks floating in vision, blood in the white of the eye. These are not all the possible side effects of SYFOVRE. Tell your healthcare provider about any side effect that bothers you or does not go away. Call your healthcare provider for medical advice about side effects. You may report side effects to the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Please see the SYFOVRE full prescribing information for more information.
Well, today we continue our series on experiencing the power of better health. Urologist Dr. Peter Stahl is here, head of men's health at HIMSS back with us today. And the topic that we're talking about today is really kind of sensitive, but it's really relevant. ED, erectile dysfunction. It's estimated that it affects almost, get this, 30 million men in the United States. Thank you so much, sir, for being a part of it. For sure. Look, everybody knows what ED is, basically, but why do men at some point in life all seem to suffer from it?
Yeah, well, turns out a lot of things need to go right to get an erection. It starts in someone's brain. You have to be aroused and excited. You can't be too nervous. You need signals from your brain to go down your spinal cord through your nerves. That means all your nerves have to be working perfectly. Blood needs to flow into the penis, which requires really healthy blood vessels. The penis needs to hold on to that blood, so it itself needs to be healthy. And all of that is governed by hormones. Any one of those things can go wrong, and they often do. And if that happens, it results in ED.
And is age a factor?
Yeah, so age is definitely a factor. So younger men more often have psychogenic erectile dysfunction related to anxiety or sometimes hormonal. And in older men, it's more likely to be related to nerve function, blood vessel function, or it can be a reflection of underlying metabolic diseases like diabetes, high cholesterol, or even cardiovascular disease. You know, a good rule is 30% in your 30s, 40% in the 40s, 50% in their 50s, 60% in their 60s. Those are the percentages of men in the United States, roughly, that are estimated to have ED by decade of life.
How does HIMSS, work in this area?
ED was one of the very first conditions that we approached because when HIMSS started, we were focused on stigmatized conditions. What we've built at HIMSS is an online platform that is designed to bring expert level care to patients seamlessly, discreetly, affordably, and without requiring the embarrassment that results in avoidance of care for something like erectile dysfunction for a lot of men.
And HIMSS provides some solid solutions?
Yeah, so for ED, we've been really focused on getting people the right medicine and personalizing that treatment as much as we possibly can. That is really critical to taking care of the whole person. For example, ED might be the warning that you're gonna have a heart attack in 5 to 10 years. And we have built a platform that can recognize risk factors, and our ED Plus Vitality Pro product is actually a daily ED medicine combined with atorvastatin, a cholesterol medicine that is proven to reduce the incidence of heart attacks and strokes. So that's a great example of personalized medicine, tackle their ED and help them stay healthier and live longer and have more years to enjoy good sex with their partner.
Are these methods safe and effective?
Yeah, they're safe and effective. And just to get back for a second to personalization, one of the things that we've loved to see is that, traditionally people really struggle to take their cholesterol medicine. But it turns out when you marry someone's cholesterol medicine to their ED medicine, suddenly it's a little bit more motivating, right? But you asked about safety, and safety is embedded to our entire process, from the questions we ask patients to our electronic health record that supports provider decision-making on our platform, to our pharmacy. Quality and safety are gigantic for me in our job and huge for our company.
So where can our viewers go to get more information?
Yeah, so our company is called HIMSS, and they can go to our website, hims.com. They can find us on Instagram, they can find us on other social platforms, and they can download our app in any app store.
Dr. Stoll, thank you so much for being with us today, my friend.
Thank you,
for
Montel.
sure. I'm really looking forward to our next installment, our next segment. So if you want more information, you can always go to balancingact.com. Look, as we conclude our 6-part series, Beyond Dentistry, the importance of the mouth-body connection, Doctors Lulu Tang and Dr. Bianca Vallejo are back with us. Thank you so much for being here. And we're talking today about hormone health as it relates to women. Yeah. Welcome back. Thank you.
Thank you for having us back.
For sure, absolutely. Look, tell me a little bit of that. So women have really unique oral health concerns, but can you go a little bit deeper? What happens when it comes to hormonal levels?
Yes. Many of us back home watching, we don't realize that our hormonal changes during our menstrual cycle, pregnancy, or even menopause is causing this increased risk for problems in the mouth, teeth, and gums. And in addition, when we're taking hormonal birth control, like the pill, the shot, vaginal ring or hormonal intrauterine device, IUD, that is increasing our body's hormones progesterone and estrogen. And these increased levels can cause our gums to become red, sensitive, or swollen. So it's really important that we are making sure that everyone does regular dental care visits, especially pregnant women or any women at all stages of life, so that we can manage their oral health and in turn manage their overall health.
Dr. Vallejo, can you take us a little bit deeper? Let's talk a little bit more. Let's really dig into this mouth-body connection.
Yes, absolutely. Lots of research have found that oral health problems are associated with other medical conditions like diabetes, high blood pressure, Alzheimer's disease. For pregnant women, infections in the mouth can even affect their unborn baby.
That's crazy.
I know, causing low birth weight, preterm births, preeclampsia, even miscarriage.
Really?
Yeah, and so that's why it's so important. We encourage all women to come to the dentist because how does gum disease start? It starts with plaque, and plaque is a thin film of bacteria that builds up on your teeth, and if left untreated can spread and lead to bleeding gums, bone loss, even loose teeth. But it doesn't stop there. The bacteria can actually spread to different parts of your body and just make you overall sick.
Smile Generation offers something that's called salivatory screenings. Talk a little bit about that. What is that? Why is that so important?
So at Smile Generation, we go beyond traditional dentistry because we're prioritizing the mouth-body connection. So all of our providers, we understand and advocate for oral health and overall health. And we are connecting patients to a network of vetted Smile Generation trusted offices with high quality, patient-centric care. So all of our offices have innovative technology to increase your level of care, a major part being this salivary screening. And this allows us to have early detection of potential health issues. And then we're now able to do not only preventive care, but proactive care. And all of this is to empower the patients through the journey.
And you're such a powerful force for good in the community also, right?
Yeah, absolutely. I mean, you can always count on Smile Generation Trusted Dentists to do a thorough medical review. Our goal is to make sure that everyone's empowered to take care of their oral health and their overall health. I mean, in my practice, for example, any patient that shares with me that they're trying to conceive, going through IVF, or even have had histories of miscarriage, I always empower them, like, let's do the saliva testing. We need to know what's happening. We print out the results, I review it with their OBGYN, and oftentimes that oral health link is one of the missing pieces of the puzzle that's affecting their overall health. And I'm so proud to say that I've been able to be part of many people's pregnancy journeys, positive pregnancy stories. And you know, it just goes to show that's the overall mission of Smile Generation. We're just helping empower our communities, be at force for good, like you said, both locally, globally. We're here for education and, you know, just telling people how we can be healthier.
Yeah, and a couple components to that. I mean, the biggest component is improving access to high quality oral health care. And like Dr. Vallejo said, increasing this oral health education, such as helping people understand what is this mouth-body connection.
Sure. Final thoughts.
Definitely make an appointment with a Smile Generation Trusted Dentist. We're here to take care of your overall health. Get your saliva testing done. Knowledge is power, and you don't know what you're up against until you get that data. And we're here to help you figure out all those best choices to help you be healthier and happier.
Thank you both for being here. And look, if you want more information, you can always go to smilegeneration.com, or you can go to our website, thebalancingact.com. Thank you. Thanks so much for joining us today.
That's right. Make sure to head to our Facebook page, like us on Instagram, follow us on X, and visit thebalancingact.com to enter our latest sweepstakes giveaway.
Be safe, love that family of yours. We'll see you next time.